Well, we just learned yesterday that a new strain or variant of coronavirus has been identified in Southern California. First popped up in the UK, then in Colorado. We all kind of figured it was here already. Still a lot of questions about what this means, though, and Dr. Ernst von Schwarz, nice enough to join us on New Year's Eve to talk about this. Good morning, doctor. Thank you for being here.
Good morning, Joe. Thanks for having me on.
All right, you are a wealth of knowledge when it comes to this stuff, so tell us about this variant. What does that mean? Are viruses always changing like this?
Keep in mind, the virus itself is not, by definition, a living organism. The virus needs cells. So in order to basically replicate, the virus has to mutate, create mutations to make them more capable of enter healthy cells. So that new variant, which we call B.1.1.7, has at least 17 mutations, which alters the genetic code, which enables those viruses to enter healthy cells much more easily. So there's more mutations actually on the horizon, of course, because viruses always change in order to survive, basically, to use the cells for their own replications.
What does this mean for vaccines that are now being rolled out? Do we think that this variant would still be stopped by the vaccine?
Well, it needs to be determined, of course, but the vaccines are thought to be effective. What is known is that that variant, the B.1.1.7, has definitely a much higher transmissibility, meaning they're much more contagious, up to 70%. So more people will get the virus. The vaccines are supposed to work against that variant too, but of course studies are underway. Latest announcements both from the companies Pfizer and Moderna stated that the vaccines will be effective against that particular variant.
You're working in several hospitals down in the Los Angeles County area every day. What has a hospital on a daily basis been like for you recently?
Oh, it's a nightmare, Joe. It's an absolute nightmare. I mean, I've never in my entire professional career of 30 years written so many death certificates like I did in the last few weeks. Keep in mind that if you look at the CDC numbers, 40% or more of patients above the age of 80 who are admitted to a hospital with COVID right now don't make it out. They pass away, basically. Among the youngest, fortunately, of course, the numbers are much, much lower. Among 40 to 50-year-old patients, only 4 to 5% die. But it's an absolute disaster. The hospitals are packed. The ICUs, intensive care units, respirator beds are all full. Many hospitals have cut down now elective surgeries. The ERs are packed, people standing outside in line, waiting to be seen and evaluated. It's a nightmare.